So in December 2021, I was on my way to work and was the victim of a random act of violence. And my daughter at the time was 2 years old. I had extensive injuries. At the University of Chicago, they put me in touch with Legal Aid Chicago.
We're the largest legal aid provider in the Midwest. We have over 100 staff attorneys, several paralegals as well, that are all trying to meet the demand of the clients that qualify for our services. That can address housing, public benefits, security from violence, debt, everything you can imagine that can impact someone that is struggling just to kind of make ends meet. We come in to help and provide legal assistance without charge, and we want to serve as many people as we can.
There was some level of recognition that there was a power imbalance, in our healthcare system, and that there was a lot of power in lawyering up. If we want to make a lasting impact, we have to address the root cause. We kind of have the system where we do an initial screener, provide the information to legal aid, and then they interact with the patient and then are able to kind of touch base with us, touch base with the violence recovery program, and figure out, if there are additional needs or if there's any kind of coordination of care that needs to be done.
A lot of the things that we work with clients on are things that they don't realize are even legal issues. We do a lot of public benefits applications and appeals, and I think people kind of think of that as more of you submit an application and it's done, either you get it or you don't. But in reality, there's often a long appeals process to make sure that people get the benefits to which they're entitled.
We have to actually look at things that are not just about interpersonal, but structural. It's a tale of two cities when you look at Chicago, right? It's really a tale of the city that has resources and those that don't. This isn't about individual choice. This isn't about your network. This is about policies and practices that have been shaped by race and racism.
So working on the medical legal partnerships practice group in particular is really interesting because the zip code that somebody lives in is one of the largest determinants of their life expectancy. We're also predominantly seeing people who live in the south side of Chicago and on the west side of Chicago, and we're trying to level out that historic inequality.
The people that I've encountered and I've dealt with Legal Aid Chicago, it's been, they've gone above and beyond. I didn't know much about what they did and the services they offered, but one thing I can say is it hasn't cost me a dime out of pocket. And they've put in extensive hours on my behalf, taking phone calls, filing paperwork, just navigating and getting supplemental benefits or things of that nature. They've been a great benefit to me and my daughter. I mean, it's an invaluable resource.
We often think about health in the context of what someone's blood pressure or their heart rate or their physiology is. But total health involves all aspects of their health care. Many of our patients don't leave their challenges or social needs when they enter the trauma bay, but they continue on throughout their hospital stay and far beyond.
People who commit a crime are legally, under the Constitution, entitled to a lawyer. And a lot of people don't realize that protection does not exist in the civil world. And the civil world is where you can potentially lose your job, your housing, your children, your safety, your independence. And so the need is obviously very real, and it is not protected.
Our program has engaged over 12,000 patients since our hospital-based violence intervention program launched. And so what we have saw to date is hundreds of thousands of dollars of access to public benefits. When we really talk about comprehensive recovery, it has to begin with stability. That was not possible before we had this relationship with Legal Aid Chicago through this program that we call Recovery Legal Care.
We have social workers that are involved. We have doctors who are committed. And now we have lawyers that are all saying, we're going to work together. We're going to put the patient in the center to really maximize the effect of whatever legal work that we could do.
We want to make sure that everybody who needs a lawyer or who is going through an important civil legal process has access to the same amount of justice that somebody who has a lot of money to spend on a lawyer would.
I think that, hospitals and the healthcare system, it's a great place to kind of start that relationship. And so I think through this partnership, we've learned that this model works and that it is a really good time to kind of catch folks and engage them and kind of make a change and a difference.
They were integral in my making it through one of my lowest points in my life. So without Legal Aid Chicago, I don't know how I would have navigated that space and that time in my life.